Our next witness is Angela Rachidi. Angela spent, I think, 10 years or something like 10 years working at the agency I used to work at, the New York City Human Resources Administration. She left there as the Deputy Commissioner for Research and Evaluation, and just recently she began at the American Enterprise Institute as a research fellow based in New York City. Angela, we're glad to have you. Thank you for being here.
Thank you. So Co-Chair Chilton, Co-Chair Dorr, Commissioner Member Sykes, thank you for the opportunity to testify this afternoon to the National Commission on Hunger. I appreciate the opportunity to discuss very low food security among some of our nation's households and how to address it. As Robert just mentioned, my name is Angela Rachidi. I'm currently a research fellow in poverty studies at American Enterprise Institute, or AEI. At AEI, I study various issues related to poverty and low income. I primarily focus on how work and work-related supports influence poverty. I recently joined the AEI, as Robert again mentioned, after spending almost a decade working for the New York City Human Resources Administration, or HRA, in the past 6 of which I served as the Deputy Commissioner for Policy Research and Evaluation. And as you know, HRA is the city's main social service agency, administering the SNAP as well as emergency food program, along with other income support programs. So during my time at HRA, I conducted various studies, number of studies of SNAP and how it affected New York City households. I experienced firsthand how SNAP is administered in a large city like New York, and I have extensive knowledge on the eligibility process and requirements, as well as how families experience it. I spent a number of days in SNAP offices observing interviews, talking with recipient households through data collection, so I do have a rich sense of the experience that these families receive. My comments today draw from that experience and focus on households with very low food security and how to address it. So there's basically four points that I would like to make. First, that SNAP is largely adequate to meet the food needs of households if they participate in it. Number 2, we need better ways to target low-income households that experience an economic shock that may require immediate food assistance, whether that assistance is temporary or ongoing. Number 3, we need broader anti-poverty efforts that reduce work/income disruptions that likely contribute to very low food security experiences. And 4, we need much better data on the causes of very low food security, including the relationship between very low food security, work income disruptions, and food assistance program participation. Before I discuss these specific points, I want to review some key data points from the Household Food Security in the United States in 2013 report, which I know everyone is familiar with, but I wanted to pull out a few key points. As you know, very low food security refers to households that have a disruption in food intake or reduce their food consumption because of a lack of resources. Fortunately, the number and percentage of households with very low food security in the U.S. is low. In 2013, 5.6% of households experienced very low food security at some point during the year. And among children in these households, very low food security was almost non-existent. Even though this is good news, it should not diminish the concern for the 6.8 million households in the United States that do experience very low food security. A reduction or disruption in food intake due to a lack of resources can be very traumatic for families, even if the children are shielded from it. Therefore, let me review some key data points on these households that informed my recommendations for reducing it. First, among poor households, the vast majority, 81.5%, do not have very low food security, suggesting that our food assistance programs adequately address very low food security among most poor households. Almost 90% of households with annual income under 130% of the official federal poverty measure who experienced very low food security received SNAP in the previous 12 months, which means that only 10% did not receive SNAP in the previous 12 months. And this suggests to me that the reach of the program is large. Households with very low food security are not all in poverty. In fact, almost 1/3 have annual incomes above 130% of the federal poverty level, and 20% have annual incomes above 185% of the federal poverty level. This highlights an important dynamic among very low food security households and suggests that many of them are not chronically poor or without resources for the entire year. And finally, households with very low food security spend on average $37.50 per person per month on food. The same actually as households with low food security, but $12.50 less than food secure households. This suggests to me there are resources in households with very low food security. In addition, a good deal of research has been conducted on the causes of food insecurity, which I will just briefly review for context. According to a review of this research by Craig Gunderson and James Ziliak in 2014, food insecurity, and in most cases very low food security, is correlated with poor relative maternal, mental, and physical health, so poor health among the mothers, drug use, and family composition, including single mother and non-resident father households. Much of this is not surprising, given that these factors are also correlated with lower work levels. In terms of triggers into food insecurity, again, not surprisingly, research finds that household composition changes, income changes, and the deterioration of a mother's mental or physical health triggers episodes of food insecurity. The data and the research I've just reviewed suggests a few important considerations when thinking about policies designed to lower very low food security. First, as I mentioned, the data suggests to me that our food assistance programs are appropriately targeting those with very low food security. With only 10% of households with very low food security not participating in SNAP, this suggests that SNAP is reaching those most in need. Some might argue that this means SNAP is inadequate to meet the needs of the 90% of households that receive it. However, I would caution against interpreting the data this way. It is very possible that these households entered SNAP after experiencing a disruption in food, and SNAP prevented further disruption. There is no way to know from the survey data the sequence of food disruptions and SNAP participation. My research at HRA, my previous research at HRA, suggests that SNAP is largely adequate for most participating households. At HRA, we conducted an analysis of SNAP benefit redemptions among participating households. We analyzed the percent of the total monthly benefit that was redeemed each week and found that the majority of households spend their benefits throughout the month, rather than exhausting them within the first week, and many had some benefits left over at the end of the month. Specifically, we found that by the end of the third week after the benefit issuances, 44% of SNAP households had not yet exhausted their benefits, meaning we defined that as meaning they had $5 or more left on their EBT cards. And by the end of week 4, when most received another monthly benefit, 30% had more than $5 left on their card. Considering that many households shop for a week or two of food, we concluded that the SNAP benefit amounts appeared largely adequate for most households, although clearly not all, based on these redemption patterns. Had we found that most families exhausted their benefits in the first week, we would have had much different conclusions. Second, the data suggests to me, and the research largely confirms, that very low food security is a temporary situation for most households that experience it and likely results from a temporary economic shock. For example, a sizable proportion, 32%, as I mentioned earlier, of households with very low food security have annual incomes above 130% of poverty. The federal government has done some research on this. A 2002 report found that this was not due to a measurement error, that some of these families either had household composition changes during the time of the survey, or they experienced an economic shock. The latter two reasons suggest that at least some of these people in these higher income households are in fact poor, based on the household composition changes, while the former, the economic shock reason, suggests that some of these households are poor only at some point in time during the year. Higher income households that experience an economic shock may not be aware of existing food assistance programs or may not want them. Data on the frequency and duration of food insecure conditions further suggests that most households that experience these conditions do so in a very limited way. Most households with food insecurity in the 30 days prior to the food security survey reported that they experienced these issues in only 1 to 7 of the previous 30 days. This does not diminish the issue. Rather, it helps better understand that the level of very low food security is fortunately limited and helps inform what can be done about it. Given data limitations, there's no way to know from a representative survey perspective whether houses that report very low food security experience it while receiving SNAP, prior to receiving SNAP, or never receive SNAP at all. Nevertheless, we can assume that all three scenarios occur, and that an economic shock that triggers very low food security can happen in any of these three scenarios. Within this context, I make the following policy recommendation. Developing mechanisms through SNAP that allow for immediate and possibly temporary food assistance that helps households get through an economic shock should be considered. Ways can be considered for those currently receiving and those not receiving SNAP. For those not receiving SNAP at the time of the economic shock, developing ways to administer SNAP benefits in a quick and possibly temporary way, which streamlines the application process and requirements for qualifying households, may be appropriate. It is also possible that those who experience a temporary economic shock need temporary benefits, but not recurring benefits. Making it easier for these families to get benefits quickly may minimize the experience of food disruptions without requiring ongoing benefits for those who do not need or want them. For those who need ongoing benefits, they can continue to apply for those benefits. Currently, emergency or expedited SNAP benefits are already provided in this manner when a household demonstrates that they have no income or no money on hand for food. Using expedited SNAP benefits to help households with food disruptions can address the temporary nature of an economic shock when a full application for ongoing benefits is not needed or wanted. Clearly, an economic shock can also cause very low food security while a household is already receiving SNAP, and ways should also be considered to provide emergency benefits for households receiving SNAP when this occurs. For example, a SNAP receiving household that experiences a job loss should be able to get emergency benefits based on their revised income quickly, and there should be expedited ways for them to access these benefits. Other ways to increase the use of SNAP for families who need them quickly should also be considered. Efforts to share data across programs, such as Medicaid and unemployment insurance, can be explored so that when someone applies for SNAP or these other programs, their data can be shared in order to reduce the burden on applicants. Similarly, efforts to accurately communicate what is available through SNAP are still needed. The fact that SNAP benefits and other food assistance is available when job loss or other income changes result in a temporary situation is not, in my view, communicated very well. There has been a great deal of information sharing about the ongoing nature of the program, but less about the availability of benefits on an emergency or temporary basis. Research we conducted at HRA suggested that some households are actually still unaware of eligibility requirements for SNAP. We conducted 3 annual surveys and found that there were three of the most common reasons why people did not participate in SNAP, even though they were likely income eligible. First, respondents did not think they were eligible, which to me suggests a lack of knowledge. 2, the respondents did not know how to apply or did not understand the eligibility requirements, again suggesting a lack of knowledge. And 3, the third most common reason was actually the respondents said they did not want SNAP, even though they were eligible. This suggests that for those experiencing very low food security, information about SNAP eligibility rules and how to apply may still be useful. Some might argue that emergency food programs are already available to address these economic shocks, but the data show that only 35.3% of those with very low food security used food pantries and only 5.7% used soup kitchens. Unfortunately, it's not clear whether this is due to a lack of access, lack of information, or other reasons such as stigma. More research is needed to determine the reasons. My guess, after visiting a number of food pantries in New York City as part of my role at HRA, is there is a great deal of stigma involved. Expedited SNAP benefits to help these households may be preferred because it allows the household to control their food purchases and avoids the potential of stigma. My third point is related to broader efforts that focus on financial security of households as it relates to their food security. Food security and very low food security are important concepts that deserve attention, but for most families, these constructs are the result of a broader experience of poverty. Not having enough resources for food is the same as not having enough resources for living expenses. This does not mean that focusing on food insecurity is not important. Instead, it means we need to emphasize the food security implications of our nation's anti-poverty policies at the same time that we consider our food assistance programs as part of these broader efforts. Within this context, I would advocate for anti-poverty policies. I also just want to mention I'm concerned, though, within that context about recent proposals to increase the minimum wage, because I believe that the minimum wage may actually reduce jobs for some of those most vulnerable at the bottom of the income distribution. I feel that better strategies are to increase the earned income tax credit or child care assistance to these families that provide direct resources going into the household. Finally, in terms of gaps of knowledge, we need to have a better understanding of the causes of very low food security. Understanding the role that work and work disruptions, in addition to other income or expenditure changes, will better inform the appropriate policies to reduce very low food security. Existing survey data fails to tell us definitively whether job loss, changes in household composition, increases in other expenses, or similar events create the very low food security experience. Without knowing the cause, it is difficult to develop appropriate policy solutions. For example, we do not know very much about household participation in SNAP or other food assistance programs at the time of the household's very low food security experience. In addition, we do not know very much about how expenditure changes, such as medical expenses or housing expenses, contribute to very low food security. Better understanding the sequence of very low food security, federal program assistance participation, and the specific causes would do a great deal to help us develop policies aimed at lowering very food security. And I will end there. Thank you. And I can respond to any questions that you may have.
Thank you very much.
I have a couple. One of them is particularly interesting was the data on what remained on the EBT card at the close of, we hear often, as you know, that people have exhausted their benefits by the third week. Perhaps a couple of questions. When you look at that, were you taking into account just the food stamp allotment, or were you also looking at the expectation that on paper, at least, people are meant to be supplementing food stamps with 30% of their own income?
We only looked at the total food stamp allotment. We did do an analysis, however, based on the income budgeted on the case, which told us whether they had the full allotment or the reduced allotment. And we also looked at it based on those who had a full allotment versus something else. And we did, there were obvious correlations that those that had more benefits seemed to have more benefits left at the end of the month. The expectation is that those that have other resources in the household to provide for food, they would spend their SNAP dollars first and then use those resources for later in the month.
My second question is, you pointed out three reasons, including two of them that, implied lack of knowledge, lack of the understanding the application process, lack of knowledge of the program. The third one is interesting to me because it was people that were eligible but didn't want the benefit. I've wondered, for some time I've wondered about the transaction costs of people who will get a low benefit at the level of SNAP eligibility, that the old theory the juice isn't worth the squeeze, and that they just don't want to apply for a benefit that's nominal. And we have not made any decisions on this, but one of the items that we've been discussing is do you think that the possibility for those households, some of them elderly, some of them other, of cashing out the benefit below a certain level because it might be needed for something else other than food, is something that would be explored?
I think that would be a good idea. I should mention we did include that as an option on our survey, that the benefit was too low as a reason for not participating in SNAP, and that was not a very common reason, although I do think that is still a concern, and it's mostly a concern among the elderly because they have other income that then their benefit level is so low. But I agree that I think that if there was better communication about the benefit of even that $13 or whatever it is a month, that it could still be useful, and that transaction cost becomes very important because, especially among the elderly, they're not going to go through the ordeal of applying if they only get the $13.
Question?
Thank you very much for your testimony. It was wonderful to hear many of your recommendations. I wanted to talk about the income shock piece, the fluctuation in income, and I think that you are onto something, and I think it is important to remember that people who are experiencing very low food security or who report it actually have higher incomes than we might expect. there are some interesting papers that have come out of the researchers at the Economic Research Service that show that the income volatility of getting a job and then getting a reduction in hours or fluctuating hours, unpredictable hours, is actually a prescription for food insecurity and very low food security. And so one of the things that I think is really important is to think about the income shock that happens not necessarily when you lose a job, but actually if you're on SNAP benefits and you may be working, but you actually get a raise at the job or get a better job and therefore lose SNAP benefits. So that the loss of public assistance actually is the income shock. So you talked about emergency applications, quick turnaround for facilitating that. What kinds of recommendations might you have for helping people to make a smoother segue out of poverty if their income increases so that they may not lose their benefits so quickly?
Well, I guess my first response is that if somebody experiences a raise or an increase in income, it wouldn't be an immediate reduction in their SNAP benefits. Likely it would not take place. They are supposed to report it, but in practice, likely it's not going to take place until their next recertification period, which does provide some opportunity for sort of smoothing that out. But if they did report it the very next day and their benefits did drop the very next day, which again is very unlikely to happen, I think that's a concern. I think benefit cliffs in general, not just in SNAP, is a concern, and there should be broader discussions about how to phase that out a little bit more slowly. I mean, we have the EITC, which phases out slowly, but if you have a large enough increase in your earnings, you could potentially lose a good deal of your benefits immediately. And if there was sort of a grace period, something like that. But like I said, the way the program is actually administered, there is a grace period currently built in.
Okay, and I understand about the issue of in practice, people don't often immediately report the increase, but if they don't report the increase, they are maybe considered to be participating in fraud for not reporting that, and so there is a culture of fear if people don't report it. So I think it's important to remember that things are a little bit different. Like they may sound one way on paper, but what's happening in practice is a little bit different. But to also keep in mind that that context of people feeling like they need to tell the truth and are proud that they have gotten a job, so they're going to report that to their caseworkers, and that reduction does happen. And not only, some people consider that there's no cliff in SNAP because of they're looking at it in terms of the amount of money that a family is receiving, but there is research that shows that very low food security increases if a family has an increase in income and a loss of benefits. So I think it's something that's important to look at. One of the other things about this nature of the income volatility, the EITC, depending on the state and how that's administered, it can actually contribute to that income volatility because families may be working in June and July for seasonal work, but have to wait until January or February when they can get their earned income tax credit back. Can you talk about some other ideas about how to make sure that earned income tax credit could actually be a smoother distribution for families?
Sure. There was a previous effort to try to administer EITC benefits in a more regular way, and it was actually complete failure. The businesses didn't want to administer it, and the research actually shows that families prefer to get a lump sum at the end of tax time because they largely don't use the EITC for ongoing, operating of the household expenses. It's used to pay down debt. It's used to, buy the television, and there's quite a bit of research on that. So I would actually, I guess based on that research, not advocate for more, regular EITC type benefits. I think overwhelmingly the families have expressed that they prefer that lump sum benefit at the end of the
in your
year.
testimony, when you submit that to us, can you include that research?
Sure.
Yeah, I just wanted to amplify that point. The advanced EITC, and this is an area I'm really familiar with, was available for many, many years, and the take-up rate was far less than 10% for the very reasons you promote. But I think it was more on the recipient side even than the employer side, because in a lot of our discussions with employers, it only involved a simple another payroll field, and it wasn't that onerous for them.
I have two questions, maybe three. The first is that we've seen some writings by Bruce Meyer about the underreporting of benefit usage in the surveys regarding the CPS survey and other surveys, and not only underreporting, but also non-response. And I was curious, and I heard Bob Greenstein reiterated that yesterday at a panel discussion I was at, and indicated the extent to which people don't say the extent to which they're receiving benefits, and that these surveys are becoming less and less reliable. Does any of those findings have any relationship to the survey we're talking about here? And maybe we should ask or see research on that. But what is your sense of that?
Well, it would have implications on the participation in programs that are on the food security survey. So, in terms of participation in SNAP, participation in emergency food programs, so that is reported as part of the survey.
Right.
And so the extent that we know very well that it's very much underreported on the CPS. So the extent, and this is part of the CPS. So my guess is it's, the same issue related to this survey. The problem with the food security survey is that the relationship between the program participation and the food security it's really ambiguous. It's hard to tell really anything about the program and its relation to food security. So it may not be as much of an issue just because it doesn't tell us a whole lot, but I would guess that the underreporting is as much of an issue with this particular issue as the others.
And then the other thing, and I think you mentioned in your testimony that there was a percentage of people who report very low food security who also report in the course of a survey, they're asked a direct question about drug use. What is that?
No, that was just a review of the research, and so there was a study done using CPS data using a different data source on the food insecurity, and that did ask about various things. So that was a different body of research.
Okay.
That was the Ziliac
Yes.
study,
Yeah.
right?
And they were associated, it wasn't considered necessarily a cause.
Exactly.
Thank
right.
you.
Yes.
Yeah, I didn't say it was a cause. I just want to know. I want to know where it came from.
Yeah.
And I think that's it. Thank you.
Angela, thank you so much. I have no more questions. I really appreciate you coming up, and thanks for being with us.
Thank you.
Thank you very much.